2023, then we will still consider band 3, but we're just tightening up that criterion for 2024 entry. So I talked a little bit about aptitude testing. Different universities use it in slightly different ways. Some will weight your UCAT and they'll look at your A-levels and they'll weight your UCAT and they'll assign, say, 20% of their decision to interview you might come from your GCSEs, another X% might come from predicted grades, another X% might come from your UCAT. We don't do that. We use a threshold-based system that I'll describe in the next slide. We get lots of questions about work experience. Work experience for medical and dental school actually is really changing. And it was already starting to change before the pandemic, and the pandemic's really accelerated it. We used to, you go back 20 years, people would require some sort of medical shadowing work. Then we required caring experience that didn't necessarily have to be in a medical environment. So lots of our applicants, certainly pre-pandemic and still now, would work, for example, they'd do some volunteering in care homes, they might volunteer in hospitals, they might volunteer out in the community, doing work with vulnerable adults and children, with patients, out in the community there. Some people would go on structured work experience programs, so some hospitals and often groups of GP practices will organise structured work experience projects that you can apply to. Lots of people know doctors and other healthcare professionals, so sometimes people would shadow them for a while, and we'd get lots of questions about, and we still do, about how much work experience is required. So it helps to kind of think about why we ask for work experience in the first place. I think the main reason we ask for work experience in the first place is really so that you can prove that you've investigated the career, that you've investigated your choices, you know what you're letting yourself in for, and you know what it's going to be like to be a medical student or to be a doctor in the future. And you can do that in a number of different ways. So throughout the pandemic, a lot of the Royal Colleges, for example, the bodies that represent doctors in certain specialties, they started offering online work experience, going along to university open days, all sorts of outreach projects. You can use any of those things as online work experience. So we accept both online and face-to-face work experience. We don't assess your work experience before you get to interview, so it doesn't form part of the decision on whether to interview you or not. What happens is that you fill in a non-academic information form that I'll tell you about in a second. Tell us about the work experience that you've done, and then one of your interviewers will have that information in the interviewer station, and they'll discuss with you your work experience or the other activities that you've done in preparation for applying to medical school, and it will form part of the interview discussion, and you'll be able to reflect on what did you get out of that work experience. So I think my take-home message from this slide is please don't worry too much about work experience. It is far less important than it used to be. It's still really a vital part of applying to medical school. But you can do it online, you can do it face-to-face, you can have a mixture of different activities there. Great. So on to the non-academic information form. We don't read the UCAS personal statement. We do reserve the right to read it. In fact, we reserve the right to use any information that we have about you in deciding your application, but we don't, in fact, there's only a few medical schools that still read the personal statement, so we don't really read the personal statement. What we do is once you've applied, we'll send you a separate form, which is the non-academic information form, and that's a bit like a structured personal statement. So if you've written a personal statement, you haven't wasted your time, you can copy and paste some bits out of your personal statement into the non-academic information form and expand on them. Okay, most medical schools will send you something that looks like this. They'll want some sort of structured experience. You can tell us about your motivation. You can tell for why do you want to be a doctor? Why do you want to be a medical student? Why Manchester? Why this particular program? Tell us about the time that you worked in a team. You can tell us about your work experience online or face-to-face, and we don't really see that there's any difference between the two, really. Tell us a little bit about your hobbies and interests. I often get lots of questions about hobbies and interests. Again, we don't have a favourite list of hobbies and interests. You don't get 11 points for playing the violin and 10 points for captaining the football team and that sort of stuff. It is what is important to you. One of the reasons we ask for your hobbies and interests yeah, I mean, and I won't make you answer the question because I know we're a bit short of time today. But I'd normally ask the audience and say, why do we ask you about your hobbies and interests? And people would say, well, it's to show that you've got a good work-life balance. Yeah, definitely shows that you've got a good work-life balance. Shows a commitment to something. Shows that you're an interesting person. It's also there. The people that are interviewing you are practicing clinicians, they're academics, they're current students, they're recent graduates. And one of the questions that's always in the back of their mind is, can I work with this person in the future? Because very few people who start medical school drop out of medical school. Most of you that start in year one will graduate. And there isn't really a job interview or anything for your first jobs as a junior doctor. So your interview for medical school is basically your interview for the profession. So the question that's always in the back of the mind of the people that are interviewing you, are you interesting? Are you a nice, well-rounded human? Are you going to be a good colleague in the future? And if you have that question in the back of your mind when you're writing your UCAS application and when you're going into your interview, that's really, really important. Really, really important. Okay. So here's the timeline of the selection process. So again, this is for people who will be starting in 2024. We've tweaked it a little bit from 2023. So the first thing that we'll do is an academic sift. So we'll look at your GCSEs, we'll look at past qualifications that you've taken, and we'll check that your application meets our minimum requirements. If your application has met our minimum requirements, then you progress to the next stage. Okay, which is our Ucap screening. So what we'll do is we've got 397 places for home and international students. Last year we received about 3,500 applications. We interview, it varies depending on the year. The most we've ever really interviewed is about 1,800. And we'll interview somewhere between 1,400 and 1,800 students. So we'll set a UCAT cutoff to allow us to bring those people to interview. This year, for 2023, we're planning to offer people the choice of whether they have a face-to-face interview or whether they have an online interview. So it can be your choice there. Interviews, so we often start interviews just before Christmas, and then we run through really to the end of February, and we have a few slightly later mop-up sessions. So that's the window. We've got, I appreciate it can be really stressful waiting for a decision from us, but what will happen is, when you submit your application today or on the 15th of October in a year's time, it will go through to Louisa's team, and it's quite a manual process, so they will be manually sifting through your applications, and it takes us a few weeks, certainly, to complete the academic sift. Then we use the UCAT score, and then we'll invite you to interview. But if we're interviewing nearly 1,500 people, it does take us a while to get through those 1,500 people, so please bear with us. And then we'll start making offers. We can make offers in batches throughout the year. So interviews, my final thing really is just to talk a little bit about interviews. So we have a multiple mini interview format, whether it's exactly the same, whether it's online or in person. At the moment we have 5 stations for 2023 entry. We're planning to stick with 5 stations, but that could change for 2024, so just keep an eye on it. If you're invited to interview, we'll send you a link to an interview website. The Medical Schools Council has some really excellent interview preparation resources as well that you can use, including some practice interviews. And also, while I'm thinking about practice the UCAT, go to the UCAT website, practice the UCAT, do those practice papers under timed conditions. That's really, really important. Do them under timed conditions too. So what we're looking at in your interview, we're looking to see if you're a good communicator. We will have some stations where we're testing your communication skills. We'll have some role-playing stations where we get you to, we're not looking for amateur dramatics or anything like that. We're not testing your ability as an actor. We're just looking to put you in a situation and see how you respond to it. Our interview is quite relaxed and quite friendly. We like to talk in our interviews. We don't really have any maths tests or numeracy tests or anything like that, like some medical schools might do. What we want to do is we want to test your critical thinking. We want to test your ability to solve a problem. We want to test your understanding of the things that you've put on your non-academic information form. We'll have a discussion about that, what you've learned from your work experience, what you've learned from your hobbies and your interests. We'll often have a medical topic in there, so medicine in the news, there's always some sort of article in the news. I'll give you an example because I'm not using it again because I'm fed up of asking COVID questions in interviews. But we asked you a question about COVID. We said, medical topic, would you do it any differently? So we had a certain set of COVID-related restrictions. We had a good topic would be vaccination, and we'll get you to discuss that topic. It's important that you have an opinion. So the vaccination topic was, should vaccination be compulsory? So people have different views. What we'd expect you to do is to be able to weigh those arguments. And that's what we're really looking for you to do in an interview station. We're looking to see whether you can take information, weigh up the pros and cons, and then come to some sort of answer or opinion. And to a certain extent, there are not necessarily right and wrong answers. We're looking at your reasoning process, okay? So going back to that example, on the extremes, we've got meh, people can take or leave a vaccination. Some people say that they don't want vaccinating, that's fine. On the other end of the scale, you've got dragging people kicking and screaming to vaccination centres. Those two extremes are probably not the right answer. Somewhere in between probably is. Okay, so it's all about having an opinion on whatever topic it is. We've used things like assisted dying before. We've used, for example, the Charlie Gard case about withdrawing life support from children. That sort of stuff. So we've used some quite sensitive topics in the past. We give you some problem solving. So a good example of that is a few years ago. You were given a hypothetical situation, so we said, okay, you're doing some work experience in a care home, and your task is to arrange a trip to the seaside for 30 elderly residents of the care home. Off you go. Tell us what you're going to do. Okay, so it's those sorts of problem-solving skills that we're testing as well. Right, what I'm going to do is we've got plenty of time actually for some, they've done this before, for some questions. So you can ask me questions, you can ask our student ambassadors questions, so the Dean's been doing this for years, haven't you? But there we go. So introduce yourselves, guys, and then we'll wander around. You be thinking of some questions that you want to ask either me about admissions or our students. It should just come on automatically.
Hi everyone, I'm Natasha and I'm a third year medical student. And yeah, that's it really.
Hi everyone. So I'm Nadine. I'm a post-year 3 medical student. Basically, it's my 8th year here. But what I did was a longer route into medicine. So as you know, not everyone gets in first time. I got in through a biomed transfer, which isn't available anymore. And I'm currently intercalating in a PhD, which is an option here, which is good.
Okay.
But yeah.
Great. Any questions for us, either for me or for our students? So I've got one over there, got one there. Right. I'll start on this side and then I'll move over. There you go.
If you're changing to team-based learning for the 2024 cycle for years 1 and 2, does that mean if someone was to get in the 2023 cycle, then their year 2 curriculum would have changed as well?
No, the year 2 wouldn't normally have changed. So we're planning to replace PBL quite slowly. So yeah. Yeah, great. There was another question somewhere down there. In fact, just pass the microphone down. Let's do that.
Hi, my name is Mohammed. My question is, do you partner with external universities so that students can complete or do part of their training abroad? And the other question is, the ECE is a very good experience, I would say, but how do you cover anatomy? Is it also done regionally according to the subject, or is done differently? Okay,
so 2 questions there. One about international partnerships. In fact, pass the microphone back up there because there's another guy who's got a question in a sec. So you can do an elective in year 4, like I said, and you could do that at another institution. We used to run a program which was European studies. So you would be able to complete some of year 4 in a European partner institution. That program was a casualty of Brexit because Erasmus funding has gone now. And hasn't been replaced. So unfortunately it's not possible to do the Europeans so that's basically with a language. So we used to offer that program with a European language. Unfortunately, because the funding's not there for that anymore, that's not available. It isn't possible to do, say, a year abroad in medicine. There are some exceptions. So you could intercalate, for example. So intercalations where you take a year out of your degree and you study another subject, and it is possible. Certainly if the program's not available in Manchester, to go and do an intercalated degree somewhere overseas. But normally study for an entire year overseas isn't possible on most medical degrees. Anatomy, I think, was the second question. So how we teach anatomy. So it's full body dissection. It is sort of regional in that you will be, say for example, if you're in the cardiovascular cases, you'll be dissecting heart and lungs. If you're in the, say, semester 4, for example, you'll be doing abdomen. If you're in semester 3, you'll be doing sort of head and neck and some musculoskeletal stuff. You'll be doing a lot of embryology in life cycle. Can you think of anything to add to that, ladies?
So in terms, I think something to mention is, although it's one of the largest medical school in the UK, but when it comes to your anatomy, it's very on like a 6-to-1 demonstrator basis or like an 8-to-1. So you are there with the demonstrator. There's an additional teaching element these days, but like in terms of having that one like interactive aspect with anatomy, it's quite similar to the cases usually as well. So generally they all interlink because as Drew said, it's based on the element that you're doing in that half of the year. But I think it's fantastic the way it's taught here because the full body aspect is really important to see, especially if you're thinking of surgery down the line as well, but seeing it where it is exactly is important because it can differ from the textbook a bit.
Great. Yeah, I think dissection is really good. It's a really, really good thing to actually see. A typical week would involve an anatomy session, which is usually, I think, in year 1 on a Monday afternoon or on a Tuesday, and an anatomy lecture. So there'd normally be a lecture and a dissection class. Yeah, brilliant. Thanks.
Is the EPQ scored on the selection process?
No.
And then for the students, if they did an EPQ, whether you found it helpful or not?
Yeah. So from an admissions perspective, we don't score the EPQ. Obviously, if we're ever tied between students, so if we're thinking on the vast majority of people, we won't need to look at it. But we have limits to numbers of people that we interview, and then we'll have limits to the number of offers that we make. So very occasionally, if you're on a borderline, we might look back at some of your qualifications. The other time an EPQ or a 4th A level might be helpful is if you drop a grade on results day. So if for some reason you end up with 2 A stars and a B and an A star in your EPQ, then that can be the difference between us. So normally we target about the same number of places that we have, and we have got quite good over the years, with a couple of exceptions in COVID when we got some grade inflation. But as A-level grades start to go back to pre-pandemic levels, we should be able to predict the number of students that will meet the conditions of their offer quite well. But there's always a couple of students that just drop a grade on A-level results day. And if we've got the space to fit them in, we'll try to do that. And actually looking at your EPQ grades or your 4th A-level grades can be really useful. EPQs.
It's good to get, I don't know about Natasha, but it's good to get practice of academic writing quite early on. I mean, personally, I found that helpful. Mine was in thalassemia, so it was a blood condition. You could tailor it to, your interests and what you're interested in. You don't have to do one, but I think the element of trying to learn to reference, etc., and understanding academic writing is important. But do you want to add?
Yeah, I didn't actually do an EPQ, but a couple of my friends did, and I think the skills you get from EPQ of like that self-directed learning really help with this course. So yeah, like Nadine said, like the skills you get as well for like academic referencing is great, but I think it's more the skill set you get from actually doing the EPQ which will benefit you. But yeah, that's it really.
Sounds good. I think there was another one somewhere around there. Yep.
I'm applying for 2023 entry. I'm just asking about the pros and cons of online and face-to-face interviews.
What would you like to know?
Just because I've been told that you may be given a face-to-face or an online one.
Yeah.
And you might be given the choice depending on how many interviews are given. So I just want to know what the pros and cons are of choosing online versus face-to-face.
To be fair, there's not really any difference. It's the same thing. They're the same scenarios, the same stations, the same structure and timings. So the plan at the moment for 2023 is that when we invite you to interview, we'll give you the choice, and it'll be sort of first come, first served when you've been invited. When you've been invited to interview, to select whether you want it online or face to face. But there's no real difference. I think probably one of the advantages, if you haven't been to an open day and you haven't seen the university, then sometimes an advantage of having it face to face is that you can come and see the campus. Advantage of it being online is that you've got 4 medical schools. You might not necessarily want to travel to all of those cities again if you've already been here, and sometimes stay over the night before, and so there are cost implications there as well. But there's no difference really between doing it online or doing it face to face. Anything else? Right, we've got a couple I think here. Great, pass that down and then I'll go to the gentleman at the back.
Hi. How many offers do you make after interview?
Okay, how many offers? That is a really interesting question. Again, it's on our website from the historic data. So if we go back to about 2019, pre-pandemic, we were making about just under 1,000 offers per year for 397 places. Because some people choose other medical schools, other people don't make the conditions of their offer. So back then, pre-pandemic, about a third of all of our offer holders didn't meet the conditions of their offer. So on A-level results day, they dropped a grade and they weren't successful and they didn't get in. In 2020 and 2021, most people met the conditions of their offer. So most medical schools were oversubscribed. So in 2020, most were oversubscribed. We'd reduced the number of offers that we made slightly by then. In 2022, for this cycle that's just gone, most medical schools drastically reduced the number of offers that they made. So it was 500 and something in total that we made, and the year in between was about 700 something off the top of my head. It's all on the website. I can't remember the precise numbers, but you get the idea. It went down from under 1,000 to 700 and something to 500 and something. What we expect, and then we kept waiting lists. So most medical schools last year kept waiting lists. As we see A-level grades returning to pre-pandemic norms, we would probably expect to make more. So I do expect to make more offers this year, and then probably make even more offers in sort of the year after. So I think we're on that trajectory for 2023. For people starting in 2023, I'd probably be expecting to make somewhere between 600 and 800 offers, depending on how things are looking. So it's sort of increasing as we go. Was there a second question? Or that was great. There's one at the back. There we go.
Thanks. I'm just wondering, in years 1 and 2, roughly how many hours per week you'd have on face-to-face lectures, seminars, and dissection practical skills?
Okay, so from what I can remember, but my first 2 years were COVID, but I had second year as face-to-face. It was about 16 hours a week, so you have generally 6 hours of lectures. Then you also have communication skills, so that's when you practice your communication with like a simulated patient. You have your anatomy, you have phys pharm. So yeah, adding that all up, I think that it's around 12 to 16 hours, I would say. Yeah, that's about right.
But expected to do another 12 or whatever on your own?
Say that again, sorry?
You're expected to do, say, another 12 on your own?
Yeah, like you're expected. So in first year and second year, I probably did about 3 or 4 hours work a day on top of what I was doing with the medical school. So it's quite flexible. So you have enough free time to have evenings free to do what you want, really, to do a sport, to just chill, So yeah, because Monday's when the case opens, Friday's when the case closes, and then you've kind of got all your lectures, all your communication, all your anatomy to do in that time. So it can be a bit hectic, especially when you've got like other commitments. But I think it's flexible enough for you to manage your free time and have a social life and do what you want, if that answers your question. Okay, cool.
Great. Okay. Just pass that down there, we.
Hi, I applied for 2023 and I sent off my application on Thursday. And I've just been thinking about what I'm going to put on the non-academic form.
Yep.
Is that taken into account like any point before the interview? So like you say, you look at it and be like, okay, this person, like kind of like replacing the person's
No.
name, or is it just the interview?
Just looks to interview.
Okay.
Yep.
So just
Hi, for the graduate medicine, is Manchester University more favourable to applicants who have done a degree already at Manchester, or is it just like if you've got any degree you can apply?
So applying as a graduate, so you'd be applying for the 5-year program. So we don't have a 4-year accelerated graduate entry medicine program. Yeah, so anyone with a 2-1 or above, or predicted a 2-1 or above, you need to have achieved BBB at first set of A levels. Otherwise you go through exactly the same process really. So you'll obviously already know your A-level grades, and you'll probably have a good idea what degree classification you're going to get. So there's otherwise no difference because you sit the Ucat in the same way. Your offer would probably, if you're in the final year of an undergraduate course, your offer would be conditional on getting a 2-1 or above. So interview process is exactly the same. Ucat thresholds used in exactly the same way. You'd still need to meet our basic GCSE maths and English requirements as well. But other than that, same process.
And sorry, I just wanted to ask as well. I understand you're a doctor yourself.
So I'm an academic, so I don't practice. I'm an academic. Yeah.
All right. Okay. Never mind.
Yeah.
Okay,
so I teach on the program. I teach anatomy. I teach a bit of physiology. I teach some basic clinical skills. But you'll get. So I'm a full-time academic. Some of my colleagues are part-time. Sort of, I suppose, my role. About a quarter of my week's taken up by admissions. Another quarter of my week's taken up by sort of teaching on the graduate programs and on the undergraduate programs. So anatomy, physiology, some clinical skills work as well. Some people still practice. So you'll have some colleagues that will be 2.5 days a week in the NHS and sort of sometime in the university. You'll have colleagues that are fully clinical. You have colleagues that are fully academic. You have tutors, particularly in years 3, 4, and 5, where you will you'll sort of have lots of bedside teaching, and so there'll be some formal structured teaching like simulation, and then there will be some more informal teaching that sort of happens at the bedside really. So there's a whole mixture, and you'll be taught by a huge range of different professionals. So you'll be taught by doctors, you'll be taught by dentists, you'll be taught by physiotherapists, you'll be taught by nurses, you'll be taught by psychologists, by medical scientists. Yeah, huge range of people actually. Great. I think there is a question down the end.
All right. I was just wondering what your policy was on resits for A levels if you happen to miss the mark.
If you
happen to miss out on straight A's, right?
Yep, so you can resit. Yep, you can resit. You have to have achieved BBB at first sit. And if there are very specific personal circumstances, then email us and get because there's all sorts of differences in sort of the qualifications and the histories that people have got at the point of application. So if you've got any questions, it's just UG, or you can speak to us today. But yeah, you can resit. Yep.
Cheers. Thank you.
Yep. There's a question in front of you and a question behind you.
Hi, is there a specific specialty that the medical students tend to steer towards once graduating? Because I know King's create a lot of GPs and.
There's a lot of rumours out there about what people do, and our graduates go into every specialty actually, if you look at it. So no, Manchester doesn't have a tendency to graduate more of one specialty, or people go into more than one.
Well, one thing I would say is what's good about Manchester is you have like medical societies where you can get involved in there's GP society, surgical society, etc. And I think what people tend to do is just gear towards what they're interested in and going down that route. There's not one, it's not like Manchester goes for this certain specialty to like fill it up, sort of thing. Because everyone at the end of the day will graduate, become a foundation year doctor, do year 1 and 2. And quite a lot of people at that time won't actually know what they want to do yet. It starts to grow on them, I guess is the word. And then you go into the specialty training, but I think you wanted to add to that.
Yeah, I was just going to say, I read a fact recently that 60% of medical students become GPs, not at Manchester, but just in general. So, whatever uni you look at, then maybe every uni pump out GPs. So, but yeah, like Nadine said, there's so many different societies with so many different specialties that you can go into. And both of us are pretty interested in research, and Nadine's even doing a PhD. So, if anything, I think we have that option here at Manchester, which is a great one.
I suspect actually, I don't want to speak for my colleagues at King's and know them quite well, but I suspect, that's not necessarily true of that medical school actually. But we've probably got time for one more question, and then we'll wrap it up. So I think there was one at the back there.
Are exams at the end of the year, or are they throughout the year?
So exams are in January. So in years 1 and 2, you have a semester 1 and a semester 2. And semester 1 goes from the end of September to December, and then you have exams in January. And it's an exam of multiple choice questions. It's 125 multiple choice questions on everything you've learnt in that semester. And then you also have a thing called a progress test. So this is an exam that everybody sits from years 1 to 5. And again, I think it's 125 questions. Yeah. And basically in the first 2 years, you aren't really expected to know much. And then the idea is it's a progress test, so you progress as the years go by. That is the idea. So you do that in January, and then you also have exams in May. Again, it's the same idea of that 125 questions based on everything you've learned, and then again a progress test. And then you also have this thing called CCAs, so clinical competency assessments. So they're a bit like your MMIs, so you've got stations, and you've got about 10 minutes per station, 2 minutes in between each station, and you're expected to perform a task in the station. So for example, you might have to just chat to a patient and ask why they've come into the GP today, or do an injection or something on a fake arm. So that kind of stuff, and then you're assessed on that, and then you get marked, and you have to pass a certain number of stations. And that happens in May in first year, and then January and May in second year. And all the exams are multiple choice, so no essays.
What else have we got? So we've got the PEP assessment, which are things like the poster and the dissertation, and you have a portfolio assessment as well. So you're assessed on your PPD portfolio. You have a mini sort of viva, don't you, where you talk through your portfolio. Years 3, 4, and 5, you've got things called UPSAs, which are procedural skills assessment. So things like taking blood, recording an ECG, that sort of stuff. Your placement sign-offs and various things in a clinical logbook that you keep. I think that's probably covered most of it.
Yeah, I was going to say, don't let that scare you. They all come in the right time. So tests are there and exams are there just to show where you're up to in knowledge. And it also helps for you to reflect on where else you need to, points to focus on. But they do come in I like the way the Manchester does them, because it's not completely throwing exams at you every 2 seconds. So it's a graded approach and a graded exposure. But there are practical exams like the CCAs, and there's also the multiple choice. But I think students tend to find them at the right time, not every day.
Brilliant. Thank you very much, everyone, and hope you have a good rest of the day here in Manchester. Go and visit as many medical schools as you can. Good luck with your applications. They are very specific. Yeah, they're very, very specific. Yeah. She's going to be professor of medicine at some stage.